Both these men are over 70. I mean, how worrisome is that?
It obviously is a worry, because we do know that at the age of 70, your risk does go up rather significantly. In fact, if you take a look at the risk of hospitalization, it's 5 times higher risk if you are 70 or older as compared to somebody who is 30 years old. Your risk of death is 90 times higher in the 70-year age group as compared to somebody who is in their 30s. And then you take a look at the fact we have 2 men. Males are at higher risk for complications from COVID, and particularly in the case of President Trump, he is overweight, medically classified as obese. That is a risk factor for complications from COVID.
So that said, the president reportedly has mild symptoms right now. Does that mean he'll be okay?
Boy, that's a really tough one to call, because it's way too early to give a big picture, long-term outlook on this. Most people, even at age 74, will do well if they wind up contracting coronavirus. But having said that, you have to look at, we've had more than 200,000 Americans die from coronavirus. So I don't know if you can say that it's going to be mild for him. The other thing to keep in mind is, even though symptoms are mild now, what we worry about the most is there seems to be a trend that at around day 7 or 8 into the course of an illness, we worry about a sudden deterioration. That's a point when people begin to require oxygen, or when hospitalizations are at their highest. So I don't think it's going to be at least another several days before we have an idea of what the true prognosis is.
Well, and this kind of leads into my next question. I mean, we're only just a month away from the election. Any idea when he can, get back on the campaign trail?
I think it's really going to be 2 factors to consider in that question. And the first is, how well does President Trump feel? Is he fatigued? Is he coughing? Is he sneezing? Is he having ongoing symptoms for a period of time? The second factor is whether or not he's going to pay attention to the CDC guidelines on removing yourself from self-isolation. In other words, going back out into the world. The guidelines state that 10 days after you develop symptoms of COVID or you test positive, you really do need to self-isolate. And then at that 10-day point, you need to be your symptoms need to be improved, and you need to be symptom-free for at least 24 hours without using any medication to lower your fever. So it's really going to be a matter of seeing where things are at day 10.
And of course, everyone will be paying very close attention to this story. Dr. Dave, as always, we really appreciate your time.